But we've got to start this morning with COVID, and here are the facts we know this hour. Today kicks off a big two-day meeting for an FDA advisory panel deciding whether to recommend booster shots. Today, they're going to discuss Moderna. Tomorrow, it's Johnson & Johnson. At the same time, a new study says it is okay to mix and match COVID vaccines. That means just because you got one type of the shot before, it does not mean you need to get the same type of shot as a booster. But for people who got the Johnson & Johnson vaccine, it's actually better if you get Moderna or Pfizer the second time around. That study has not yet been peer-reviewed. Also today, President Biden will be meeting with his COVID team in about 90 minutes, and he'll give an update to the public just before noon. All of this is coming as COVID cases keep dropping nationwide and vaccinations keep going up, which is very good news, but neither is happening as quickly as we'd like. I want to dig deeper into all of this and start with NBC's Megan Fitzgerald. She's at a booster site in Chicago. NBC's Cal Perry is tracking the situation in New Orleans. And Dr. William Schaffner, professor of preventive medicine and infectious diseases at Vanderbilt and a CDC advisor. Megan, break down this FDA meeting for us. How's it going to impact our daily lives?
Yeah, so Steph, this is a very long, important, and methodical process here. It starts, of course, with the company. In this instance, it's Moderna and Johnson & Johnson going to the FDA for authorization. Then, of course, the FDA will hold meetings, and they will vote on these recommendations before they then issue a vote. It then will go to the CDC. Of course, they'll do the same. They're going to be holding meetings. They're going to vote on this vaccine before the CDC director will then issue his recommendation. But what this means for the folks at home is that the vaccine, if approved, these boosters would be more widely available to millions more Americans, as opposed to the Pfizer vaccine for just those who received Pfizer, since you know that just last month the FDA approved a booster for Pfizer staff.
Dr. Schaffner, so now that we're learning you can take any booster you want, it doesn't matter who you got your original shot from, what's better to take?
Well, we haven't learned that yet because we want to wait for both the FDA and the CDC to give us those recommendations. But the data would suggest, the data currently available, that if you've had the J&J, you can get a better immune response if you then get a booster with either Pfizer or Moderna. And if you've had Pfizer and Moderna, well, getting a booster with each of those vaccines really gives you a lot more antibody. I hope that the FDA and the CDC don't make their recommendations too complicated because they're difficult to communicate, and there are so many people out there waiting to get their boosters.
Then let's be honest about J&J, doctor. Let's say I am unvaccinated right now. Should J&J even be an option? At this point, it certainly doesn't sound like it works as well as the other two. Why is it even out there?
Well, it's out there because a second J&J vaccine for people who've received one does give you a big boost. Of course, you get more of a boost if you get either Pfizer or Moderna. I don't think there's much J&J vaccine currently being used, Stephanie, for initiating vaccination, unless you're very remote for some reason, hard to get to the vaccine. Then any vaccine is better than no vaccine.
Cal, I'm counting down the days and minutes. Talk to us about where we are with kids. The news that they could be getting the vaccine as early as November, kids ages 5 to 11. Where are we right now on that? Cal?
Yeah, we'll look at the national numbers first. If you take a look at nationally where we are with children and cases, they account for 24.8% of all cases right now. That is the bad news. The good news is, as you laid out in your introduction, there are a lot of bright spots as cases drop around the country. New Orleans is one of those cases. If you look at the positivity rate here in New Orleans, over a month ago, it was 16%. Now it's 3%. You look at children and hospitalizations in this city, we saw upwards of 20 children hospitalized at any given time over the summer. Now there's only 3 children at the local children's hospital. Take a listen to what Dr. Kline told us yesterday.
We're in so much better shape today than we were a month ago or 6 weeks ago. After this summer surge of Delta that happened between really mid-July and the end of August, we've seen a steady decrease in the number of new cases. And today we have just 3 children hospitalized for COVID here.
So that's the good news. The challenge, especially in places like Louisiana, is going to be actually convincing parents to have their children vaccinated. If you look at the rural areas of Louisiana, sometimes that vaccination number can be as low as 40, sometimes 30%. And again, that's the parents. We've heard this from physicians here on the ground, convincing parents to get their children vaccinated, especially, again, in the rural parts of a state like Louisiana. That's going to be the issue, Stephanie.
Cal, Dr. Schaffner, Megan, thank you all so much. We're going to leave it there.